When I was diagnosed with cancer, my insurance had just ran out, and so they had made a lot of provisions for me to be able to continue my whole diagnosis and my treatment.
This is one of the main areas that we study in my role as a researcher at the Hutchinson Institute for Cancer Outcomes Research, is this bigger problem around financial and insurance barriers to care. The fact that care is expensive, it leads to changes in work and income, and navigating the whole process of getting optimal insurance and maintaining that insurance coverage can be very confusing for people. So we've done a lot of work trying to shed light on this problem and find that the majority of people going through cancer treatment face some kind of financial issue during the course of their care, and it can be highly stressful, and it can have impact on their outcomes.
It was actually said to me a couple times that they thought I was on welfare, and my after treatment was has been delayed and no follow-up.
So we've been doing a lot of work trying to understand the impact of financial navigation. Essentially, people who are assigned to patients to sort of address all of their financial and insurance concerns during treatment and help with issues that arise, to see if doing so will actually help improve outcomes in the long run. And I think it will. So I think in her case, that sort of communication, not just at a single time point, but longitudinally throughout care, is really important.
I do believe that being Black creates more challenges of advocating for yourself, in the sense that they don't always put you in position to ask the questions that you need to ask, or to even know the information that you need to know in order to advocate for yourself, or even know what the process should be that you're walking through.
Well, I have no doubt that it makes it more challenging. There's definitely evidence that people face racism in medicine. This is a fact, and we need to do a lot as a community to overcome racism, overcome implicit bias. I think I'll just add that a lot of what we've been studying is and working towards are solutions that we can implement in the clinic. Things like financial navigation, cost transparency tools, tech solutions to make it easier to align patients and families with financial assistance resources. But let's not forget, there are larger solutions at the policy level that could help patients much more broadly. And I think it's important for us as researchers and as clinicians to also raise our voices and get our research and findings out to inform policymakers.